Chapter 8, Skeletal System, Axial and Appendicular Skeleton. All right, we are moving on to the appendicular skeleton. Appendicular skeleton is composed of 126 bones, and primarily these bones function as levers for movement. So muscles pull on them, causing movement to occur in our limbs. Conveniently enough, though, we are have bilateral symmetry. Means our right and left sides are very similar to each other, which means actually there are 63 bones because there's 63 right bones and 63 left bones, giving us the 126 number. Makes things a little easier. All right, the pectoral girdle is the structure that attaches the upper limbs to the axial skeleton. Specifically, the clavicle forms a joint with the sternum. That's the official joint attaching the upper limbs to the axial skeleton. The pectoral girdle is made up of the clavicle and the scapula, the collarbone and the shoulder blade. The joint where the clavicle attaches is known as the sternoclavicular joint. Again, the only place where the upper limbs make contact with the axial skeleton. The clavicle looks a little S-like in shape, has three important features. It has an acromial end. The acromial end articulates with the scapula, has a bump that sticks out inferiorly, known as the conoid tubercle, and then it has a flatter sternal end. The sternal end articulates, surprise, surprise, with the sternum. Scapula. Scapula is a flattish, rather triangular shaped bone. The scapula has a number of important features. It has this large, smooth depression known as the subscapular fossa, lies against the thoracic cage. It has a glenoid cavity. We can't quite see it, but is a depression that articulates with the head of the humerus. The glenoid cavity then moves up to this piece of bone known as the coracoid process. Here we can just barely see the acromion. Flip it over to the posterior view of the scapula. Here again is the glenoid cavity. Here is the acromion, which makes contact with the clavicle. Going this ridge here known as the spine. Above the spine is a smooth flat area called the supraspinous fossa. Below the spine is a smooth area called the infraspinous fossa. All right, here's again views of the scapula. Again, you can see the glenoid cavity where the head of the humerus fits in to give us the shoulder joint. Moving on to the humerus in the arm. The humerus includes the rough patch known as the greater tubercle that sticks out laterally, the lesser tubercle, another rough patch that sticks out anteriorly. Between them is a groove known as the intertubercular sulcus. So greater tubercle, intertubercular sulcus, lesser tubercle. You go down a little less than halfway along the shaft of the humerus. There's a rough area known as the deltoid tuberosity, where the deltoid muscle inserts. Down at the distal end of the humerus, we have these rough bits of bone sticking out medially and laterally, known as the medial epicondyle and the lateral epicondyle. Note that the head or smooth knob, the head of the humerus, sticks out medially, always medial. So that's how you can know this is the medial epicondyle, same side as the head. Below the epicondyles are the smooth rounded knobs. The medial two bumps come together to form the trochlea. The lateral bump is the capitulum. So trochlea, which articulates with the ulna, capitulum, which articulates with the radius. Above the trochlea is a depression known as the coronoid fossa. Above the capitulum is another small depression known as the radial fossa. Then we flip the humerus over to the posterior side, and down at the distal end, we see a large fossa. This is the olecranon fossa, which fits the olecranon of the ulna. Now, up at the proximal end, that smooth rounded knob, again, that is the head. Directly after the head is a rigid line that you can see. That line is the anatomical neck. And then a little further down is an imaginary structure called the surgical neck. It's called the surgical neck because that is the area where the humerus fractures most frequently, if it gets fractured. All right, distal to the humerus is the ulna and the radius. down in the forearm. The medial bone is the ulna, as you can see here. The ulna is connected by the interosseous membrane to the radius, which is the lateral bone. The ulna, at its proximal end, has this U-shaped smooth curve called the trochlear notch. Trochlear notch goes around the trochlea of the humerus. The lip portion, the bony portion of the ulna sticking out, here is the coronoid process. Go down to the distal end of the ulna, we see the head of the ulna that articulate with the wrist bones, the carpals. Flip over to the posterior view of the ulna. This large bump sticking out posteriorly, that is the olecranon. So if you touch the point of your elbow, that bump there is the olecranon. And then if we go down to the distal end of the ulna, we see a little point sticking down, that is the styloid process. Again, we have a U-shaped structure, the smooth U that fits around the trochlea called the trochlear notch. It is made up by the coronoid process sticking out anteriorly and the olecranon sticking out posteriorly. Olecranon, posterior. All right, that brings us to the radius. The radius is the lateral bone of the forearm. The radius has this sort of cylindrical structure that is the head. So the head of the radius. It articulates with the capitulum of the humerus and also articulates with the ulna. Following the head is the neck. So this region is the neck. There's a largest rough patch that sticks out. That is the radial tuberosity. So head, neck, radial tuberosity. And then we go down to the distal end of the radius, this little bit of bone sticking down. That is the styloid process. So the three bones that come together to give us the elbow joint is the humerus, the ulna, and the radius. Again, the humerus's trochlea articulates with the trochlear notch of the ulna, and the humerus's capitulum articulates with the head of the radius. From here, we can see the forearm in the supination formation, where the palm is facing anteriorly, or the pronation formation, where the palm is facing posteriorly. You can see that the radius and ulna will cross over when they are pronated. So that is why our anatomical position has the forearm supinated or with the palm of the hand facing anteriorly. The wrist bones are known collectively as the carpals. There are 8 carpals. We have to learn their names. So there's a mnemonic in a textbook, I think it's in your textbook, that is stop letting those people touch the cadaver's hand. This is the one I know. And so the first letter in each of those words is a same as the first letter that starts in the name of the carpals. So along the proximal 4 carpals, you have scaphoid, lunate, trichatrium, pisiform. Stop letting those people. And then the distal 4 carpals, trapezium, trapezoid, capitate, hamate. Touch the cadaver's hand. So scaphoid, lunate, trichatrium, pisiform, trapezium, trapezoid, capitate, hamate. All right, the metacarpals is the collective name of the bones that make up the palm of the hand. There are 5 metacarpals. They're named 1, 2, 3, 4, 5. So metacarpal 1, metacarpal 2, metacarpal 3, metacarpal 4, metacarpal 5. And it starts with the number 1 and the same side as the thumb. So in the anatomical position, that would be lateral. Then we have the phalanges. The phalanges are the bones that make up our fingers. So there are 14 phalanges, 5 fingers, 14 phalanges. Phalanges are referred to as proximal, middle, and distal. So the reason why there's 14, though, is the thumb only has 2 phalanges, so we only have proximal and distal. So this would be proximal phalanx 1, distal phalanx 1, proximal phalanx 2, middle phalanx 2, distal phalanx 2, and so on. And that is it for the upper portion of the appendicular skeleton. We'll continue in the next lecture.